Look at you, listening to Spotify while
Good afternoon, everyone. Thank you so much for joining us. My name is Courtney Nilsson, and I'm an occupational therapist and clinical director at our Park Place location at Spear. I'd like to welcome you back for those who have attended one of our webinars before, as well as those who are joining us for the first time. We appreciate you taking the time out of your busy days to learn with us. For those who do not know, Spear is a private outpatient practice that has been around over 20 years. We currently have 26 locations all over the New York City area, and we have successfully continued to offer in-person care throughout the COVID-19 pandemic, along with launching our Spear Live for those who are looking to stay in and receive care through our telehealth platform from the comfort of your own home. In our clinics, we are strategically going over and above and beyond all the CDC guidelines to ensure safety and well-being for everyone. You can find more detailed information about the safety guidelines that we've been following at our website at spearcenter.com. We are here for you whether it makes you more comfortable at home or in the offices. If you are looking for individualized care, either the clinic or through telehealth, please reach out to us. We'd be happy to get you set up with an appointment right away. Today, I'm very excited to be discussing all things about traumatic finger injuries, as well as some of the anatomy of the hand, diagnosis, injury presentation, causes, splinting, exercises, and treatment progression of each of the conditions. As you can see, we are coming from you live from various locations of Spear clinics, and although we don't expect any technical difficulties, it's technology and sometimes things happen, so please be patient with us. Throughout the webinar, we definitely want to hear from you all. If you have any questions, please feel free to use the Q&A feature that is on Zoom. To find that, you'll please just take a moment to hover your mouse over the bottom of your screen and you'll see a Q&A option pop up. And that's where you can put any questions and we will do our best to address as many as we can during the webinar. It is best to put your question in the Q&A. If you put the question in the chat feature, we sometimes don't get to see it. So better to do it in the Q&A instead of the chat during the webinar. For those who are watching YouTube Live, we are also monitoring the comment section. So please feel free to also type in there so that we can get to your questions. And lastly, there will be times where multiple panelists are on the screen. So the best way to view that is in gallery view, which is on your, if you want to select that, you go to your top right corner of your Zoom screen so you can be able to see all the panelists at once. So let's talk about our goals for the day and what we will be covering. We will be understanding the basic hand anatomy, understanding common injuries to the hand and fingers, understand how to identify different injuries and basic treatment guidelines, review effective exercises that can be done from the comfort of your own home. All very exciting things. And before we get started, I'd like to introduce everyone to our panelists today. So we're going to go ahead and invite everyone onto our screen. All right, our presenters today are Daisy Lee, who is an occupational therapist of one of our Tribeca locations on Chambers Street, and Kendra Berlotta, another occupational therapist from our Park Place clinic in Tribeca. And lastly, we have Kathleen, who's an occupational therapist and certified hand therapist working with Spear Live, and she'll be helping us answering your questions in the Q&A today. And just a reminder to be in that gallery view so you can see everyone. And if you've done that, you should be able to see all three of us right now. All right, let's get started. Kathleen, Daisy, and I are going to say goodbye for now, and Kendra is going to take it away.
Thanks so much, Court, for getting us started. And thank you, everyone, for joining us tonight. We appreciate you taking the time out of your busy schedules to learn some common finger injuries. So we are excited to share some of the common injuries as OTs that we're seeing on a day-to-day basis. And first, we wanted to start off with a little bit of anatomy, kind of more of the dry stuff, but it's definitely important to cover. On the left, we're going to start with the left image. We kind of have the bones in the hand. We have the metacarpals, which are kind of what make up our palm. There's 5 long bones right in our palm that make up those metacarpals. And we also have the phalanges, which are kind of our finger bones. We have little phalanges. There's 3 of them, kind of in each finger. And then between those finger bones, we have little joint spaces. We have the DIP, which is the one furthest away. And DIP is a distal interphalangeal joint, distal meaning furthest away from the body. And then we also have the PIP, which is more proximally, so that's that middle joint. Those are the two joints that are going to be good for you to remember, because we're going to be going over a little bit of that a little bit later on. And those fingers, we're going to move on to the middle picture now. So those joints are kind of held together by little collateral ligaments, which are kind of on both sides of those joints. They are kind of what help to keep your fingers from going too far out to the side. So they're really our stabilizers in our hand. Ligaments are what connect bone to bone, so that's definitely important to remember. And then on the right side, that photo kind of shows our tendons. Our tendons are what connect our muscle to our bones. So we have the muscles in our forearm actually are what kind of control our hand moving. So you can see that on the bottom photo. And then on the palmar side of our hand, we have our flexors. So that's what brings our fist nice and into a closed fist. And then brings our wrist down. And then we have extensors on the back side of our hand, which brings our wrist back and our fingers kind of splayed out to the side. So I know it's a lot of information to start with. So we're going to get into our first injury now. Great. Thank you for that. So the first injury we're going to be talking about is the Boutonniere Deformity. Now that is an injury to the tendons on the back of your fingers called your extensors. And if you remember, those are kind of what bring our wrist back and our fingers back into this position called extension. So your extensor tendons, they kind of travel all throughout your fingers. And if you can see in that bottom right photo, it travels all the way into our fingertips and attaches at many different spots. So all of our finger can come back at once. Now with the Boutonniere Deformity, the extensor tendon kind of tears away at the middle joint, which is what I kind of circled in that one photo on the right. You can see it's completely detached in most cases. So a lot of times, since there is no tendon attachment, you're going to present with this kind of hyperflexion in this middle joint, and you have this hyperextension in this end joint. And as I said, because there is no attachment at that middle joint, you're not going to be able to kind of extend your finger at all. That's a very common presentation. So it's often caused by something kind of hitting the tip of your finger and kind of bringing you into that hyperflexion, hyperextended position. A lot of times the middle joint is going to become tender. It's going to be painful, swollen, bruised a lot of times. So definitely some things to look out for. Other times you can get like a deep cut or a laceration kind of to the back of your finger, just kind of slicing that tendon right off. So now that you kind of know the presentation, what's next? What are we going to do for treatment? The most important thing we want to do as far as treatment-wise is definitely consult with a doctor early on. As you remember, kind of all of those pathways that extensor tendon is splitting, there can be injuries to all parts of that tendon. So we definitely want to make sure we're getting an accurate diagnosis. It's also important to see kind of the extent of damage. Sometimes it might be just a little bit of a strain, while other times it can be fully torn off. So it's definitely important to kind of get that checked out, get some imaging done. And if a boutonniere is confirmed, your doctor may provide you kind of with that little brace you see on the right bottom corner. It's like a little metal blue brace. Very common is what you'll see, something at an urgent care or something like that. And usually it'll be worn for about 4 to 6 weeks, depending on the severity of the boutonniere. And it's going to be worn during the daytime and the nighttime. So that's definitely something important to remember. You're going to want to limit any gripping, any pinching. Anytime we don't want you bending your hand into a fist at all. So you're going to want to kind of maintain that extension throughout the duration of the 4 to 6 weeks. So you're really not going to want to do any heavy dumbbells at the gym, any bike riding where you're kind of holding those handlebars, or even like holding heavy pots and pans. Actually, at Spear, a lot of our OTs actually make custom splints, which custom splints are really molded and kind of form fitted to you. So if you have any swelling, any kind of deformities, we can definitely work with you to help make a splint for you. I actually have a sample one here, which is great for boutonniere deformity. It's a little bit less bulky. It's a little bit more form-fitting right to my finger, and it helps to keep me in that extended position. And what's also great about this one is you'll be able to kind of keep that top joint free, which is really important. Sometimes when you splint the whole thing, the whole finger can become stiff. So just splinting the affected area sometimes is really helpful. And then after those 4 to 6 weeks, your doctor is going to have you start to wean from that splint, which means you're going to start to take it off, which is great, but you definitely want to ease into kind of progressing to take it off. So your therapist can definitely help you with kind of a weaning schedule, which is really important. You're not going to want to go right back into the gym. You're going to want to ease into all light activities. So typing, anything like that, we're going to want to ease into. And then for most injuries, we're going to want to achieve more of a kind of composite fist that's pain-free before we get into some of the strengthening exercises. So Daisy and I are going to go over some mobility exercises at first, and then kind of later on, we're going to go into the strengthening exercises. If we want to change over to the camera. A lot of injuries do have a strict protocol, but this one is kind of based on how you're feeling, which is important to kind of keep your therapist aware of what you're feeling, any tightness, any stiffness. And then one of the exercises I do like to start with, if everyone wants to practice me, that'd be great. But kind of just lifting your finger up and off. So I even like to do like a little pen hurdle where you're coming up and over the pen. That's a great one. And then kind of opening and closing your hand. Those are really great ones to start with. You can see my extensor tendon kind of strengthening a little bit as well. We're doing that repetition is important. We like to say 2 sets of 10. In the beginning, it's kind of might be a little bit less just because you might be in some pain. You might be feeling it kind of all down that hand. That's very common as well. And don't think you have to remember all these. We're going to provide a handout for you at the end of this. And Daisy's going to get into our next injury.
Hi, thanks, Kendra. So our next injury is collateral ligament injuries. So like Kendra had mentioned before, in each of our finger joints, there are ligaments, and ligaments, that what they do is they connect the bones to each other and they check excessive motion. So in each side of our finger joints, we have ulnar collateral and radial collateral ligaments. So the radial collateral ligaments are on the side of the finger joint that's closer to our thumb side. So this would be my radial collateral ligament of my index finger, and this would be my radial collateral ligament of my middle finger. And then the ulnar collateral ligaments are closer to our pinky side of our hand of that joint. So this would be my ulnar collateral ligament of my index finger, and this would be my ulnar collateral ligament of my middle finger. So like I said, they check motion. So with radial collateral ligaments, they check excessive sideways motion going towards our pinky side. So this motion right here. And then for our ulnar collateral ligament, it checks excessive sideways motion of that joint going towards my thumb side. So it'll be going this way. It'll check this motion. And most commonly, we see collateral ligament injuries of the PIP joint, which is these joints right over here, with a common mechanism of injury of like falling onto your hand or having anything like excessively like bring our finger sideways, like when a ball hits it too hard. And a common sign and symptom would be pain and swelling on the side of the injured side of the finger. So if my radial collateral ligament of my middle finger is injured, it might be a little bit tender over there, and increased sideways motion towards the opposite side. So if it was my radial collateral ligament of my middle finger, it will be increased sideways motion going towards my pinky side as compared to my unaffected hand. And also pain with motion. So now I'm going to go and talk a little bit about the treatment for an ulnar collateral ligament injury. So typically at 0 to 4 weeks, we'll have you buddy tape your finger to the adjacent finger of the side of the injured ligament. So for example, if my radial collateral ligament of my middle finger was the injured ligament, then I would buddy tape that to my index finger. If it was my ulnar collateral ligament of my middle finger that was injured, then I would buddy tape this finger to my ring finger. And buddy taping is really just to help support the finger and keep it more stable as it's healing, because we don't want any like torquing motions to like injure that finger further. And you're really just gonna like go around the finger here and tape over here, and then you're gonna go on the top past this joint and you're gonna tape it around too. So you want that joint that's injured to still have some mobility, because during 0 to 4 weeks, we also do some active range of motion exercises to prevent any stiffness. But I highly recommend you to go see a doctor to get some imaging done, because it could be a more severe ligament injury. And instead of just doing buddy taping, they might want to start you off with a splint for 4 weeks before moving the finger. But at 6 weeks, say if you just had to buddy tape your finger, we'll just do some passive range of motion. So I would move my patient's finger, trying to see if we can get more motion. At 8 to 10 weeks, we'll begin doing some strengthening exercises. So I'm just gonna go over some of the exercises I would start with my patients. So an active range of motion exercise I would begin with would be something called tendon glides. So I would start here, fingers all straight, and then I would go into a hook, and then I'll come down into a full fist. Then I'll let the last joint kind of come off and make a flat fist. Then we'll come up into a platform, and then we'll go back all the way straight again. So I'm gonna demonstrate that one more time. So straight to a hook, to a full fist, to a flat fist, to a platform, and then straight back up. And I usually have my patients start off with like 1 set of 10, because it's kind of a hard exercise, and then we progress as we go on. And then when we do strengthening at around 8 weeks, I like to use something called a digiflex, and there's different colors. Each color has a different tension. This is the lightest one, so I'd start with that. And I just like to have them press each one and then press them all together like that, just to get some strengthening of the fingers. Okay, so that's it for the collateral ligament injuries. Kendra's gonna go over the next injury.
Easy. We are going to be showing you guys a few tools today, so feel free at the end to email us if you're interested in purchasing any of these tools. They're definitely on Amazon and easy to get, and they're great tools for everyone to use. Just to maintain the strength in your hands, that's really important in our day and age when we're using the computer all the time. Now, similar to the boutonniere, we have the mallet finger. This is another common injury to the tendons on the back of your hand, which are your extensors, again, which bring us back into that wrist extension and finger extension. But what's different this time is that the injury is more to the tip of your finger, whereas with that boutonniere, the middle joint was affected. With the mallet finger, that tip of your joint is going to be more affected. A lot of times that tendon is kind of torn away, as you can see on that top photo on the left. I have it circled in red where that tendon kind of tears away from the tip of your finger. Causes of this typically are a blow to the tip of your finger. Your finger's going to come all the way back like this. That tendon might snap, and then you're going to see this presentation of your finger coming forward. What's important to remember is that you will be seeing a droop, and you won't be able to extend your finger similar to the boutonniere. So definitely don't freak out right away. Go see your doctor, go to an urgent care, get it assessed. A lot of times this happens during sports where someone has a basketball or is playing volleyball, and the ball just kind of hits the tip of their finger, comes all the way back. They don't realize that the force was so hard, and that finger comes all the way forward because that tendon tears off a little bit. Also, a lot of times it happens when you're kind of making the bed, when you tuck that kind of sheet or your pillowcase under your close to your headboard and your finger kind of hits the head of your headboard and you don't realize, and you're like, oh gosh, my finger. And then you see this kind of presentation of your finger looking a little bit forward flexed. So definitely get it checked out right away. Oftentimes on that top right photo, you can see a little piece of bone can also come off. So definitely important to get it checked out, get some imaging done. Sometimes it may need surgery, so definitely important to kind of check those things out. It's also important to understand the severity of each injury so it can be properly treated. A lot of times that end joint is going to be tender, it's going to be bruised, it's going to be swollen, it might be a little numb. So definitely important to get it assessed. And then as far as treatment for a mallet finger, a mallet finger actually has a very strict protocol, and there's a lot of complications if it's left untreated. Your doctor may provide you a splint, so kind of that top image, you have that little tan splint. It's kind of what maybe an urgent care will provide for you. And it's usually, you want it to be in either extension or kind of in this hyperextended position for about 6 to 8 weeks. Another custom option we do are some of those images on the bottom. A little bit more comfortable, easily removable, and they are pretty sturdy on there. I have like another similar one here. You can kind of see that hyperextended position of my finger. Kind of keeps it fluid, keeps it moving, keeps it breathable as well, which I feel like is really important. And what's important is within those 6 to 8 weeks, it's really important to not bend your finger at all. And if it does come into a fist at all during those 6 to 8 weeks, you'll actually have to restart the splinting program. I know that sounds terrible, but that's why it's so important for therapists to be upfront to let you know, like, hey, this is what could happen. We really want to be careful with this injury. Your therapist will kind of help you to learn how to take the splint on and off. That way it's not bending at all. You want to make sure you're still cleaning your skin, checking it for any redness, anything like that. And after those 8 weeks, your therapist and your doctor has cleared you to kind of begin taking that splint off. Your therapist is going to help you with the weaning process to take it off very gradually. It's important to not take it off too early or get back into exercise too quickly. So we don't want to go right back into the gym. We don't want to be going right back into holding pots and pans. We definitely want to take it very slow because we don't want to cause too much stress on that tendon. A lot of times it's normal to see kind of a lag of about 5 degrees. So it's most of the people don't even notice 5 degrees. It's very slight. But if you do take that splint off too soon and you begin doing exercises that are too difficult, that finger can begin to droop again. So we definitely want to make sure we're checking in with doctors, checking in with our therapists to see if we're noticing any droop that's a little bit more than they expected. A lot of times after those 6 to 8 weeks or 8 to 12 weeks, your finger is going to be very sensitive. It's going to be stiff. It might be tender, painful, and possibly even numb. So your therapist is definitely going to help you to kind of manage those symptoms. One exercise I really like to start with are something called isolated joint blocking. This is a great mobility exercise for really any finger injury. So what you're going to want to do is you're actually going to hold the bottom joint and the middle joint, kind of holding it in place like that. And then you're going to bend that top joint without the other joints moving. So it's really only getting motion at that distal joint, which is really great. A lot of times it's going to be stiff afterwards. So you might only get a few degrees of motion, which is totally fine. Everyone's going to be starting at a different spot after those 6 to 8 weeks. And then eventually the goal is to get all the way down here. And then we will get down to that middle joint and even getting into kind of a hook where we're moving both that top and middle joint at the same time and still holding that bottom joint, getting more fluid motion. This one's going to be a little bit more difficult because your tendon's kind of in that really lengthened position in this exercise. So it might be a little bit more difficult than this one, but both great exercises to start with and progressing very slowly until a full fist. Great. And then Daisy's going to head over and chat about the next exercise.
So our next injury is a metacarpal fracture. So there are many different types of metacarpal fractures. If you look at the image on the right, there are metacarpal head fractures, which are at the very, very top of the metacarpal. The metacarpals are the joints that are the bones that are on the palm. That makes up your palm. So the metacarpal head is at the very top, the wide part at the very top. A metacarpal neck is kind of right under the head of the metacarpal where it starts to narrow a little bit. Then you have the metacarpal shaft, which is right in the middle, and then metacarpal base fractures, which are at the very bottom of the bone. We're going to be talking about the metacarpal neck fractures, specifically a boxer's fracture, which is mostly at the metacarpal neck at the 4th and the 5th digit, so your ring finger or your pinky. And it's called a boxer's fracture because a very common way of getting it is in you're hitting an object with a clenched fist. And oftentimes it's going to present with pain, swelling, and bruising at that affected knuckle. So like you'll see it like some swelling and bruising over here. You might have pain with some motion, but I highly recommend that if you suspect that you have a fracture, to go see a doctor to get some imaging done. Now we're going to move on and talk a little bit about what treatment would look like for a boxer's fracture. So if you have a boxer's fracture, typically you will start with having a splint or a cast on for 4 to 6 weeks, and you'll be splinted in an ulnar gutter type of cast or splint. So your metacarpal phalangeal joints, the joint right here, is going to be at about like 70 degrees of like flexion, and then their IP joints, these two joints over here, are going to be straight. And the reason why you're casted in that manner is because that's going to keep the ligaments of those joints in the most lengthened position. So it will make it easier in therapy, so they won't be as stiff when we start moving. So after your cast comes off, or your splint, you'll start range of motion exercises around 4 weeks. And then at 6 to 8 weeks, you can start beginning some passive range of motion. I like to gauge this on like how much pain my patients has too. Like I'm not going to really push them super much at passive range of motion if it still hurts a lot. Also at 8 weeks, when the fracture has healed, we'll start beginning to do some strengthening exercises. And around 10 to 12 weeks, you'll be able to return to your activities. But this always depends on the patient and their level, how much pain they have and how much motion they have at that time, and how their strength is. So some exercise I would do for range of motion, again, another one that I would do that I did for the collateral ligament injuries would be tendon glide. So going over that again, it was this one, going into a hook, then a full fist, flat fist, a platform, then coming back straight. Another one that I like to do is something called finger lifts, because extension gets really stiff. So I like to just have my patient kind of lift each finger off the table like that. It'll be a little bit painful in the beginning because it'll be really stiff when you first start moving it. So I really typically start with like 1 or 2 sets of 10. And then some strengthening exercises I like to do. I like to do some stuff with putty again. So I have some putty here. I have this dowel, kind of working on some grip strength. I like to have them press into the putty with the dowel, like that. I also like to do some pinching exercises. So with the putty, I would kind of make it into a log like this, and then I would just pinch with my ring finger and my pinky with my thumb, do some pinching like that. And if you don't have putty, this one you can do with like a rolled up towel at home. And then I also like to work on some wrist motion, because if you looked at the splint from earlier, it kind of also prevents you from moving your wrists, so you might be a little stiff afterwards. So I like to do, let me just put this down. So I have this wedge, I like to do some wrist curls. So working on wrist extension, I just have you come up like this. And then working on some wrist flexion. I'll have you bring your palm up, and then we'll just bend up like that. And then I also like to strengthen the wrist later on. So I have a dumbbell over here. So I'll do the same thing, wrist extension. And I'm doing this over a wedge, but you can always do this like over the edge of a table. And then wrist flexion, bringing my palm up and doing it like that. Okay. So now Kendra's gonna go over another injury.
So the next injury we are going to be going over are the flexor pulley injuries. So the first two injuries I discussed were really to the back of the hand. This one is more to the palm of the hand, which are flexor side, which brings us into kind of this full fist and bringing our wrist forward. Your pulleys are these little square bands, if you can see all the way on the right, the top images. They're like these little square kind of like ligament looking structures in the palm of our fingers. They are really what keep your tendon nice and close to your finger, kind of like how a fishing rod keeps that line really close. Pulley acts in the same way where it keeps that flexor tendon really close to your bone. Now, a lot of times this gets injured when a significant amount of force is applied to your fingers, where kind of like in rock climbing, where I see this often in rock climbers, where you're in this kind of flexed forward position, you're scaling up that rock, you're kind of putting your whole body weight on it, and your flexors are working really hard, and your pulley just can't withstand that pressure. A lot of times you'll either sprain it or you can even kind of tear the whole thing. There's an image that shows both a little bit of a sprain and kind of the whole pulley has been ruptured. Most times people will really feel like a popping sensation, and it'll be quite painful. And soon after, you won't be able to make a fist really easily. You'll feel a lot of pain kind of on the palm side of your finger, right in the center a lot of times, when you're making that fist. Some people might feel tenderness, bruising, swelling. A lot of times those are common symptoms. There are a different number of pulleys in the hand, so it's important to get it checked out by a doctor to see which one was torn or which one was injured and how severe the injury was. As far as treatment-wise, definitely getting it checked out by a doctor is important to obviously determine which one was injured. Even with a slight sprain, your doctor may want you to wear a little bit of a splint. Can we go to the next slide, please? Thank you. You have just one slide back. Yeah. You have the one on the bottom, which is more of a one that you can purchase online. It's a little ring that kind of acts to keep that tendon in place for you. Since that flexor pulley is not working as it should be, you can kind of see that in that image on the left. That tendon might pull away a little bit, which is what we don't want. We want to keep it nice and close to your finger. So that metal option is a great option to kind of keep that tendon nice and close. And then those purple ones are actually ones that we can custom make for you. A lot of times people have swelling in their hands, so this is a great option. And we can have you come back into the clinic, get it checked out as your swelling goes down, and kind of progress it from there. For the first few weeks after your injury, you're going to want to limit all gripping and pinching and any kind of lifting, carrying where you're making a fist, so it doesn't worsen at all. We don't want to make that sprain turn into a tear, so it's important to limit all of that gripping and pinching. And then some easy exercises we want to start with. A lot of those tendon glides are important. We want to work on those finger lifts, as well as that blocking. Those are all great ones to start with. Another great option as you get into your strengthening is kind of a towel squeeze. You're going to want to like put a towel into a little bit of a circle and just lightly squeeze it out first, probably about 20% of what you're capable of, just to start in a nice light progression. And then really getting into that full squeezing fist. Another great option is that putty that Daisy was showing you before. This you can buy on Amazon as well if you are doing kind of a virtual appointment. These are great options on Amazon. They come in different colors, different progressions, different resistances. So an exercise I like to start with actually is kind of this exercise called the squeeze and roll. where you're squeezing all the way in as hard as you can and then spinning it, working all of the muscles in your hand, really strengthening them. And we will provide a handout at the end of all these exercises, so don't feel like you have to write it down. Great. And we'll head over to the next exercise.
So our last injury is the thumb ulnar collateral ligament injury. So like I was mentioning before, the ulnar collateral ligaments are closer to your pinky side. So the ulnar collateral ligament of the thumb is here. And then the radial collateral ligament of the thumb would be like right here at the metacarpal phalangeal joint, this big knuckle right here. So an injury to the ulnar collateral ligament is typically from falling on an outstretched hand that's going to pull your thumb back and away from your hand. And typically an acute injury of this would be like skiing, when you fall when you're skiing, and that's also why it's called skier's thumb. But you can also get an ulnar collateral ligament injury to your thumb from chronic wear and tear. So if you play a lot of sports where like you might have like a trauma to like your thumb, a constant pressure pushing your thumb this way, it can lead over time to some instability of that ligament. So some common ways that it'll present as it's just pain and bruising, swelling, weakness of grip and pinch. You're going to see some tenderness at this ligament right here, again on this side, and your thumb might just feel loose and unstable. So ulnar collateral ligaments check excessive motion going radially, so going this way. So if this is moving a lot more towards this side as compared to your other hand that's not affected, then it's likely that you might have a thumb ulnar collateral ligament injury. So going towards treatment for ulnar collateral ligaments of the thumb. So you'll get splinted for about 4 to 6 weeks in what we call a thumb spica splint. So that's really going to just help stabilize your thumb. You'll have this joint free, but the rest, this other joint's going to be like wrapped around. And that's just really to help the ligament heal for about 4 to 6 weeks. And then from there, we'll start to do some range of motion exercises. And later on, around like 6 to 8 weeks, depending on how the pain is, we'll start doing some gentle gripping and pinching exercises. So for active range of motion exercises, I like to begin with for the thumb, I like to do something called opposition slides. So you'll touch your thumb to each one of these your fingers. And then once you hit the pinky, you're going to try to slide your thumb down to like the very bottom of your pinky as much as you can. So again, to each finger, once you get to the pinky, slide down like that. I also like to do something called thumb ABCs. So if you were to pretend that you have like a piece of paper here and you're just going to draw the ABCs out with your thumb. I usually have my patients do 2 sets of 10 of this from A through Z, and I'll be like, do capital case the first time, and then you can do lowercase the second time. And then for some strengthening exercises, I like to do, again, I like to use the digiflex, so just bending the thumb a little, just pressing down. You can also use putty to strengthen as well. So a strengthening exercise for putty. You can do some pinching like we did earlier. So opposing to each finger and pinching with the thumb. Like that. You can also do a more functional pinch strengthening. I like to do a lateral pinch, which is the pinch that we use when we're like holding a key. So I put it like right on my index finger, curled up, and then I just squeeze down like this. And again, you can do this with like a rolled up towel if you don't have putty at home, like that. And then another thing that I like to do, just working a little bit of like extension of the thumb, I like to make donuts. So I make a donut with a putty, and then I put my fingers in the hole, and then I just open like that. And this one, If you don't have putty at home, you can do something similar with a rubber band, just putting your hand in the rubber hand and then just opening out like that. I'll just demonstrate that one more time. Good, okay, like that. So that concludes our presentation part of the webinar. I'm going to invite Courtney and Kendra back for some questions.
Hi everyone, awesome job you guys, and we can get to go answering some of your guys' questions. So one of the first questions I wanted to address that we got is what type of doctor would you go for these finger assessments? And just to kind of dive into this first is that we are more than happy to see you guys for an initial eval and kind of refer you out to someone that we think is the best fit for that. But we can definitely see you for an evaluation and then refer you out to someone. We definitely have doctors that we know well and can kind of use our resources there. Daisy and Kendra, do you guys have anything else to add to that question?
Yeah, we definitely do collaborate with doctors quite often, kind of following up on your care, reaching out when we do know that you're going to schedule an initial evaluation with the doctor. The doctor we usually refer to is like an orthopedic hand specialist or an orthopedic hand surgeon. If you may be a candidate for therapy, there's also orthopedic shoulder doctors, elbow doctors. So definitely important to kind of reach out to the best doctor for you. As I said, we do have a lot of connections with doctors, so definitely great to kind of come in and see. It's important to have a good relationship with the doctor, so we do oftentimes have that, so it's a good option.
Awesome, thank you. Another question for you guys is what can be done to reduce the swelling of the joint after a fractured phalanx?
So what I like to do, I do like a little bit of like a retrograde edema massage with a lot of my patients. So just trying to like bring the swelling back into the body, into the lymphatic system. So I kind of like try to keep your like hand elevated. So like if it's like a finger, you want to go from like far away to coming closer to your body. So I just kind of start going to gentle motions, just going down. And then I'll do this about like 10 times. And then I'll like go down to the wrist about 10 times. And then I kind of push back into the forearms like that. And also just trying to keep your hand elevated as much as you can to just get that swelling to continue to go down. I also use Coban wrap. I don't have it with me right now, but I'll just like teach my patients how to wrap their finger. I usually have them like maybe do it for 2 hours on and then 2 hours off, having them rewrap and making sure that it's not like too tight or anything throughout the day.
Yeah, just to piggyback off of that, swelling is sometimes one of those things that you kind of have to keep up with. As you start to drain the swelling and then you put your arm down, that swelling is going to start to pull back in your hand, which is why it's really important, as Stacey said, to keep it elevated, keep it over your heart. So kind of sleeping with your arm maybe propped up on 2 pillows, and kind of limiting any time that your hand is really hanging down like this, because that fluid is going to start to drain back into those fingertips. A lot of times we use like a cold compress, like an ice pack, to kind of help with swelling as well. That retrograde massage is really great. We usually see kind of instant changes in swelling, but then as you start to kind of do things day to day, that swelling comes back in. A lot of times as that swelling comes out, usually a lot of it comes back. So I usually say every time we do retrograde massage, probably 15 to 20% is really going to go back into your lymphatic system, and the rest is really going to come back to your fingertips. So definitely something that you're going to have to keep up with as far as swelling.
Thank you guys. Another question. It's kind of explaining what happened to their finger. So I sort of popped my middle knuckle one time and it popped it back in place. The doctor only said that the doctor said that it can happen sometimes and that if it happens once, there's a good chance of it happening again. Do you know why and how to prevent this from happening?
Yeah, so a lot of times when you do have like a dislocation of your finger, those ligaments, as Daisy was showing, those collateral ligaments can become loose. They're kind of like a rubber band, so they really hold those bones together, but as it kind of comes out of place, that might lengthen a little bit and kind of a little bit out of shape, overstretched, and we want to a lot of times work to strengthen those ligaments. A lot of times I'll have patients obviously start with easy things, those tendon glides, that blocking, just to make sure that stiffness isn't present. And then we'll get into a lot of stuff like working opening and closing, like side to side, to kind of strengthen those collateral ligaments. So I'll do like kind of like opening and closing if that index finger was injured, opening and closing, and then switching it to the other side, opening and closing. Keeping that stability, keeping that strength in that ligament is going to be really important. So your therapist is definitely going to help you with kind of an exercise program. Kind of opening and closing is another great one. A lot of great exercises with the putty will be really helpful. Anytime you're doing this side-to-side motion, those ligaments are going to be helpful. So even with the putty kind of going in and out, once you have kind of that more pain-free range of motion going side to side, opening and closing your finger in that putty, or putting kind of this pen between your fingers and pushing in is another great one. Definitely keeping up with strengthening, keeping up with stability will definitely help your finger to possibly not pop out again.
Great job. I think we have time for just one more question. What exactly is trigger finger, and can this happen in the thumbs?
Trigger finger is an overuse injury. It's usually caused by excessive gripping, and it's inflammation of the pulley, the flexor tendon pulley, at typically the A1 pulley. So it's like usually like around like here. And you can get trigger finger of your thumb just from like a lot of like motions like this. Oftentimes can lead to trigger finger of the thumb. With trigger finger, I know treatment wise, a lot of it has to do with like splinting, like just trying to like splint it so you're not moving your finger as much to get that inflammation to come down.
Thanks. All right, one more then. We got one more question. Is cracking your knuckles bad for you?
A lot of times people ask this question a lot, actually. Cracking your fingers is actually just like a release of gases between your joint space. So I kind of went over like in between the bones and here you have this little joint space. And sometimes, you know, when you wake up, it feels kind of stiff. You're like, why do my hands feel like this? So you try to crack your fingers. It's just like a buildup of this gas. I believe it's nitrogen kind of in your fingers. And when you crack them, it's just kind of releasing that gas. So it's not a bad thing. A lot of times people think it causes arthritis. I don't believe that's true. So you can keep on cracking your knuckles, everyone. Keep on strengthening though.
Good. All right. If we didn't get to your question today, I'm sorry. We'll definitely get to it and answer it in an email to you. We hope that everyone enjoyed today's talk and found it valuable as we learn to treat more hand injuries and difficult finger injuries specifically. As a reminder, today your presenters were Kendra Barlotta and Daisy Lay, and feel free to jot down their information, which is presented on the screen now. You can reach out to them directly via email, ask any questions, or if you want to schedule an appointment with them, that's how you would do it. You're also feel free to call into any Spear location and we can get you scheduled. Our Q&A moderator was Kathleen, the OT and CHT for Spear Live. Feel free to reach out to Kathleen or myself as well. We are happy to answer any questions and facilitate getting you the best care possible at Spear with one of our great therapists. And at Spear, we treat an array of conditions, even though we are talking about just the hand and fingers today. We treat from head to toe. So a reminder that we are open for both in-person and telehealth visits. Should you feel the benefit of having some individualized guidance and treatment, please don't hesitate to reach out to us individually. We are more than happy to coordinate your care. Lastly, we'll be continuing our webinar series into 2022, covering a variety of topics. So we look forward to seeing you there. And please follow us on social media and check out your inboxes to learn more about the upcoming topics and schedule. Thank you again for spending your time with us, and we hope you enjoyed the webinar and wish you all the best. Be well.